evening. Happy New Year. How are we?
Happy New Year to same to you.
Happy New Year's.
Hello, Auntie, Tita.
Hi.
Miss you, miss you, miss you.
Oh my God. I
I
missed you
miss
guys
you.
too.
We missed you so much.
I missed you guys like so much. Oh my God. Hi. Hi.
Miss you. Welcome back.
I
Thank
miss
you for
you.
coming. We can't wait to
Grandma.
learn again.
Mm.
Hi, Sliman. How are you? How is everybody? Sliman, how are we preparing?
Mm.
How did our New Year or our Christmas go? How did it
Manager.
go?
It went well.
Hope we've been preparing. Hope we didn't just relax. Okay. Sliman, you can
Yes,
mute. You
we
can
were
turn
learning.
off your camera now.
Okay.
We were learning. Just that our boot camp have expired.
Yes, 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 yes. You know, we are just starting now, so we are going to work on that. Okay, so aside from this general one, you know that you have to still get your own personal bootcamp. Okay, so apart from personal, you can merge with some people and get your own so that it does not delay your preparation. Okay, so that in case where the school does not have one available, you can always have yours to run back to. Okay, you guys can merge. It must not be one person. You can just have like two people or three people that will just merge together and just get one boot camp. Okay, it's not so expensive. All right. So how are we? Where are we? It's been a minute. Where
Mhm.
are we at the moment? Where are we? Where are we? Where are we? What have we been learning? Right. So I noticed that we stopped at we were supposed to finish the hematological disorder. Right? Yes, we're supposed to finish the hematological disorder, but then we are going to round it off today. So today I just want us to do something very little, something very, very little. Just to to get us up to speed and also to to motivate us. That's what I want us to discuss. Don't mind the way I just please, if you're not speaking, you can mute your mic, okay, so that the recording is not going to be very noisy, so that whenever you want to still listen to the audio or the video, it will still be there for you. Okay, where am I now? I can see where I am. Uh-huh. Okay, so I can see myself now. All right, so what we are going to discuss now is the hematological disorders. Okay, so you're gonna let me know if you can see what I if you can see, yeah. If you can see my screen. Okay, so I want us to discuss hemophilia and also to I want us to discuss hemophilia, and then I also want us to right now. I don't know how to go back. Okay, I can go back now. Okay, so I want to share my screen. So you just let me know if you can see my screen, okay? Share. So you let me know if you can see my screen. All right.
My side, I can see the screen.
Okay, you can see my screen, right? Amazing. So first of all, I want to ask us a few questions, to get the ball running before we start off. So how many electrolytes? I know we discussed electrolytes. So what is that electrolyte that causes ST depression? What is the name of that electrolyte that causes ST depression? US and Canadian registered nurses.
Please let me try. Is it are you talking about the potassium, those things? Hypokalemia.
The hypokalemia, that is very, very correct. So in which electrolyte imbalance do we see the presence of U wave? In which electrolyte imbalance do we have the presence of U wave?
If I can still remember, then it will still be hypokalemia.
Yes, that is very, very correct. So what is the normal BMI?
Please come again.
The normal BMI.
The normal BMI.
Hmm?
Our network, please. The normal what?
The normal BMI. What is the meaning
Oh,
of BMI? If I will start from, what is the meaning of BMI? So all of
body
you
mass
have,
index.
yes,
Please,
body
body
mass.
mass index.
Yes, that is very correct. Chrisella, you're quiet. Why are you quiet? You were in class when I taught all of this. Who else was in class? I know Suleimana was not in class, but I know Chrisella, you were in class. Who else was in class? So what is the normal BMI? What is the normal body mass index? JT, are you speaking?
Please, 20.
Yes,
Okay,
the normal BMI is from 18.5 to 25.5.
that is very correct. 18.5 to 24.5. That is the normal BMI. 18.5 to 24.5. That is the normal BMI. Okay. So hope we'll be reading. I know that we discussed a lot last year. I think that maybe we met for a few days, and I think probably we met 3 weeks. But within that 3 weeks, we discussed a lot of things. There were a lot of content to be discussed, and I hope that we didn't just sit down. We didn't just let everything go. We are not starting afresh. You have to go back, and then you have to review all we have done. Take it so that you can get this done. You can get this stage of your life done and move on to something else. Okay? So now we want to discuss hemophilia. 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 Okay? So it's okay for you to call this a blood disorder. Okay? You can call it a bleeding disorder, you can call it a blood disorder. But the thing about this hemophilia is that it is an inherited disorder. Okay, so just let me know if you can still see my screen. Okay. So I want to use the chat box. All right. So everything I'll be typing here, okay? So you can just click on the chat and then you see the things I'm typing, all right? Hemophilia. All right, so this is what we are discussing today, hemophilia. So you can say that this hemophilia is an inherited bleeding disorder. So that means the person or the child got it from their parents. Okay, so when we talk about this hemophilia, we say that it is a bleeding disorder. And one thing want you to understand that this is a topic that you will always see on your NCLEX. So you can see it as a select all that apply, or you can also see it as a multiple choice question. Okay, then also you can also see it as a case study, even though it's rarely. Are you still seeing my screen? Please let me know if you're still seeing my screen. Hello, can you hear me?
Yes, please. I
Can you
can hear you. I can also see your screen.
Okay, you can see my screen too. Okay, okay. Thank you so much. So this hemophilia is a bleeding disorder, and one thing I want you to understand is that in this hemophilia, the client has an increased risk of bleeding excessively, especially when they have an injury. So, as nurses, your interventions for this condition is to prevent your client from bleeding excessively, because you know that when the client bleeds excessively, what's going to happen is the next thing is that the client can bleed to death. Okay, and now this hemophilia, there are different categories of this hemophilia. All right, we have the hemophilia A. The hemophilia A is the most common type of hemophilia. Okay, hemophilia A is the most common type of hemophilia. Then we have hemophilia B, and we also have hemophilia C. Did you get that? In this hemophilia, we have hemophilia A, we have hemophilia B, and we also have hemophilia C. But the thing is that the hemophilia A is the most common type of hemophilia. All right. And now, in this hemophilia, there is a deficiency of a clotting factor. You know, as individuals, we all have clotting factors. So these clotting factors enables our blood to clot. Okay, not to clot excessively, to clot, to make the blood to be thick, so that the client does not bleed freely. All right. So now, you know that is this clotting factor that enables that when we have injury, you know, you bleed for some time and then you stop bleeding. All right. Is these clotting factors that helps us for the blood to clot so that we don't continue to bleed. Okay. In this hemophilia, this individual lacks these clotting factors, which enables them, which makes them that whenever they have an injury, they tend to bleed excessively. All right. So now, hemophilia A is the deficiency of clotting factor 8. And they use the index. This is this. So in this hemophilia A, all right, there is deficiency. Okay, Christella, can you hear me now? Can you hear me now?
Yes, now I can hear you.
Okay, what is making you not to hear me? Is it better now?
Yeah, it's better now.
Okay, I just turned on the phone. Okay, so like I just mentioned that hemophilia A is a deficiency of the clotting factor 8. This is how it is written. It's written in numerical numbers. Yes. Okay. Did you get that? Hemophilia A is when there is a deficiency of clotting factor 8. This is how it's written. Then we have hemophilia B. Hemophilia B is a deficiency of the clotting factor IX, which is 9. Did you get that? Hemophilia A is a deficiency of the clotting factor 8. You need to know this, okay? So that when you see it in a multiple choice question, you will get it correctly. All right. Hemophilia B is a deficiency of the clotting factor IX. That is 9. Then we have hemophilia C. Hemophilia C is the deficiency of the clotting factor 11, XI. This is the way it's going to be written. So I don't want to call it 9, 11, This is how it will be written. Okay, hemophilia A is a deficiency of the clotting factor VIII. VIII. That is 8. That is the numerical number for 8. Then hemophilia B is a deficiency of the clotting factor IX, which is 9. Then hemophilia C is the deficiency of the clotting factor XI, which is 11. Okay? In a client, the most common type of hemophilia, which you're going to also see on the NCLEX, is the hemophilia A. Okay, so that one is the most common. All right, so in our clients, in our clients that have this hemophilia, most times our priority intervention is to administer the coagulation factor VII. So once you see that a client who has hemophilia, which of these is the priority nursing intervention? The priority nursing intervention is to administer the coagulation factor or the clotting factor VII. If it is B, hemophilia B, administer the coagulation factor IX. If it is hemophilia C, administer the coagulation factor XI. Do we understand? If you don't understand, please let me know. Any question? Any question?
No, no
All
question.
right. That is very beautiful. So remember that I told you that this hemophilia is inherited. So we call it an X-linked genetic bleeding disorder. Okay, it is known as an X-linked genetic bleeding disorder. All right, so usually the males are the ones, the male children, they are the ones that usually show symptoms of this bleeding disorder, of this hemophilia. Okay, this hemophilia disease is common in males. Okay, females are the carriers. So if you have, like, let's say for instance that this hemophilia runs in a particular family, the females are the carrier. Okay, they are the ones that will transfer this hemophilia to their male children. So if they also have a female children, their female child is going to be a carrier. So, but the female child will not show any symptom. It's just the way we have the genotype sickle cell, okay? Sickle cell anemia, which is the SS, right? And then we also have genotype SC. Have you heard of genotype SC? Okay, you've not heard of genotype SC. Okay, now genotype SC are the carriers of the sickle cell anemia. The sickle cell anemia is in their gene, but they don't show symptoms. They are carriers, but they don't show symptoms. But the individuals that have the genotype SS are the ones that they show symptoms. They are symptomatic. Okay, that's the same way this hemophilia occurs. The females are the carriers, while the males are the ones that show the symptoms. So it is passed down. This hemophilia is passed down, okay, from the female child to their male child. Do you understand? Do we understand?
Sorry, can you come again, please?
Okay. So I said that this hemophilia is passed down from the female child to their male child. Okay? It is passed down from the female child to their male child. The female children are the carriers, but they don't show any symptoms. They don't even show any symptoms of this hemophilia. But the hemophilia is in their gene. Okay? Do you know why? How many chromosomes do females have? How many chromosomes does females have? we have two chromosomes, like the X and the Y chromosome, right? We have the X and the Y chromosome. Then the males, they have the XX chromosome, right? The males have the XX chromosome, and then the females have the XY chromosome. So now, the gene that causes hemophilia is located in the X chromosome. Do you understand? The gene that causes hemophilia is located in the X chromosome. But we females, we are XY. That is why we are carriers. Do you understand? But then the females are carriers, not us, in Jesus' name. Those females, they are carriers. But then the males, they have XX chromosome. Do you understand? Remember that this gene that causes this chromosome is in the X and also in the X. And males, they have the X and the X chromosome. So that is why they show these symptoms, because they contain two X chromosome. That is the two genes that causes this hemophilia. That is why they show symptoms. Meanwhile, females are the carriers. They have this in their gene, but they just have one X. They just have one X chromosome. So what they will do is that once they give birth, there is a tendency of them passing that gene to their male child. Does this make sense now?
Yes.
Yes.
Any question? Any question? All right. So now, so what the signs and symptoms we are going to see is that these clients are at high risk for bleeding. Okay? They are at high risk for bleeding. Remember that there is a deficiency of the clotting factor, all right, that is going to help their blood to clot, to prevent bleeding. So they are at high risk for bleeding. If they have any minor injury, they can start bleeding. Okay? Now, another sign and symptoms is that these clients, they have joint pain. They usually have joint stiffness. They usually have joint pain. Okay, they usually have joint pain. They usually have joint stiffness. You can see that once you look at the flashcard that I just posted there, you're going to see the symptoms there. Okay, they usually have joint stiffness. They usually have joint pain because of bleeding into the joints. Okay, as a result of bleeding into the joints, they are always going to have joint pain and joint stiffness, especially in the knees, in their knees, in their elbows, and also in their ankles. Okay, they always have joint pain and joint stiffness as a result of bleeding into the joints in their knees, in their elbows, and also in their ankles. Okay, then they can also have prolonged bleeding after a surgery. Prolonged bleeding after a surgery or after an injection. All right. Then they also have bruising. They always have large bruising and petechiae. So remember that petechiae are like fragments of blood. When you know when there's hematoma. Okay, blood, when a client is bleeding, you can see some areas they will have like different dots. Okay, different dots of blood that accumulated in their skin, inside their body. That is petechiae. So petechiae is a purplish discoloration or a purplish purpose of blood. Okay, and it occurs as a result of bleeding. So whenever you
Uh,
see petechiae, speak.
Sorry, how does that write in?
Okay, petechiae. Sorry. Sorry, I'm writing. This is petechiae. Okay, this is petechiae. So whenever you see petechiae, just know that whenever you see petechiae, they say that the client has petechiae. Just know that that client is bleeding. Okay, so for the signs and symptoms, you see that the client will have joint stiffness. Okay, joint pain, joint stiffness, and it's as a result of the bleeding out into the joints. Okay, the elbow joints, the ankle, and the knees. All right. And because of this joint stiffness, the client is going to have limited mobility because the joint is stiff and it is very painful. It is an excruciating pain. So the client has inability to walk. All right. So another symptom is large bruises. So they will always have large bruises. Any mild injury, you will see them bleeding, having bruises all over their body. Okay. And it's as a result of the bleeding. Please mute your mic if you're not speaking. All right. So as a result of this bleeding, so remember that these clients are also at the risk of internal bleeding. So when these clients are bleeding internally, so we can see blood in stool, which is known as melena. So whenever you see melena, just know that it means blood in stool. Okay, so the stool is going to contain blood. Okay, so when they say dark stool or dark urine, so when the client is having coffee colored stool or coffee colored urine, it means that the client is bleeding. Okay, once the client has coffee colored stool, okay, sorry, so coffee colored stool or coffee when they have coffee colored urine or dark stool, it means that the client is having internal bleeding. Okay, all right. Now, the laboratory findings that we are going to see in our client that has hemophilia, all right, one is that, can you hear me, the platelet count is going to be very normal. The platelets are going to be very, very normal. All right. The proton beam time, the INR is also going to be very normal. Okay. But what that client lacks is the coagulation factor. Okay. Coagulation factor. Now, during a bleeding episode, now we have talked about the symptoms. Now let's go into the interventions. Sometimes a client can have a bleeding episode. Okay, they have bleeding episodes. So now these bleeding episodes are those period where the client is bleeding. Maybe they had a mild injury, or maybe they performed some sort of sport that caused them to start bleeding, or they had an injection that caused them to start bleeding freely. Okay, during the client's bleeding episode, we use a mnemonic known as RISE. You can never go wrong with this mnemonic. Okay, we use this mnemonic RISE, and the R stands for rest. So we are going to rest the joint, we are going to place the client on bed rest. Okay, the I stands for ice packs. We are going to place ice packs on the joints. Remember that the blood is bleeding into the joints. So we are going to place ice packs on the joints. Then the C stands for compression. Okay? So we are going to perform compression on the joints, and the E stands for elevation. We are going to elevate that extremity. Okay? So remember, during the bleeding episodes, that is when we do RISE. Okay, rest, ice, compression, and elevation. Any question? Rest, ice, compression, and elevation during bleeding episodes. During bleeding episodes, please don't forget. Okay, during bleeding episodes, we are going to perform RISE. Okay. Any question? Now, the other interventions that we are going to do for this client, remember that this client is lacking this coagulation factor. So this client is at risk for bleeding. So we are going to give some health education. And this is where the NCLEX wants to know, if you know, One is that we are going to encourage the client to avoid contact sports. So contact sports. So any sport that involves contact, where this person is going to hit this person can touch this person can use head to head this person, the client should avoid contact sports. So we are going to do bleeding precautions for this client. One is that you encourage the client to avoid contact sports. Then also, we are going to encourage the client to use electric razors. The client should use electric razors. Use of electric razor. Okay, then the client should use soft bristle toothbrush. Soft bristle toothbrush. Once they want to brush their teeth, they should use soft bristle toothbrush. Okay, then also we are going to encourage the client to avoid IM medications. Okay, IM medications. The client should also avoid subcutaneous medications. Subcutaneous medications. And also IV medications. Okay, they should avoid it. But in case that's in a situation where the medication, the giving of that IV medication, sorry, the IM medication is very necessary. After giving the IM medication, they should apply gentle pressure on that area, but always choose avoid IM medications, avoid it. Okay, always choose the options that avoid it. They should avoid injections, IM injections, IV injections, subcutaneous injections. Because remember, as they give it, the clients can start bleeding from there. Any mild injury leads to bleeding. Okay? Then we also have to administer the coagulation factors. Remember, when I started this class, I told you that when the client has hemophilia A, is the deficiency of which coagulation factor? Hemophilia A is a deficiency of which coagulation factor?
Clotting factor 8. VIII.
Yes, hemophilia B. Hemophilia B is deficiency
Clotting
of which?
factor.
Go ahead.
Clotting factor 9. IX.
Hemophilia C.
Patients of clotting factor of X1,
XI.
XI11.
Yes, that is very correct. So depending on which hemophilia the client has, we are going to administer that coagulation factor. Okay? We are going to administer that coagulation factor because that is what is going to just stop that bleeding. All right. So once you administer that coagulation factor, it's going to stop the bleeding. Okay. We've mentioned that. Then remember, there are some medications that can propel bleeding, that increases the risk of bleeding. There are some medications that once you give it to a client who is at risk for bleeding, it will super increase that risk, and the client will bleed more. For instance, NSAIDs. NSAIDs. Okay, so NSAID stands for non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. I know that we know these NSAIDs from our practice. So example, ibuprofen, indomethacin. Okay, these are NSAIDs. We don't administer NSAIDs to clients who are at risk for bleeding, because it will increase the risk of bleeding in these clients. Okay, we don't administer NSAIDs, we don't administer thrombolytics. Okay, such as those blood thinners, arteplase, streptokinase. We don't administer anticoagulants such as heparin, warfarin. Okay, we don't administer these medications. We don't administer antiplatelets such as aspirin. We don't administer aspirin in these clients. Okay. Any questions so far? Then another thing we can do is that we encourage the client to wear a medic alert bracelet. Okay, wherever they are going, they should wear a medic alert bracelet that is going to show that they are at risk for bleeding. Okay, they should wear a medic alert bracelet. Then we also have to help educate the parents that they should add sharp corners if they have tables, that because remember that this particular condition often occurs during childhood. Okay, so we are going to help educate the parents that they should pad any side corners or any sharp corners that will lead to injury and then bleeding. Okay, then you also have to teach the child they should report joint pain early. Teach the child the signs of joint pain and they should report it early. Any question? Okay, so this particular disease condition is also a medical, it has its complications. It can lead to a medical emergency such as compartment syndrome. Okay, so compartment syndrome, if it occurs, compartment syndrome is when those bleeding enters into the muscles, it can lead to compartment syndrome. I remember that when a client has compartment syndrome, what follows? Amputation. So that child is going to lose their extremity, either the arm or the legs. Okay, so we don't want that child to develop compartment syndrome, and it can also lead to joint damage. So let's say, for instance, that the parents does not help to educate the child on the signs and symptoms of the joint stiffness. So the child can be having joint stiffness and just don't know that it is as a result of the hemophilia. What will happen? The joints will become damaged. Okay, and then the joints will become destroyed. What will happen? The child will become paralyzed. All right, then it can also lead to intracranial hemorrhage. Remember that the client is bleeding. So if the client is having internal bleeding, that bleeding can enter into the brain, which can cause the intracranial hemorrhage, which is an emergency. Okay, which can also lead to stroke. Okay, we don't want all of that. Any question? All right. Any questions so far on hemophilia? So we are moving to the next topic that we want to talk about today, which is DIC. A lot of students hear of DIC, a lot of nurses know about DIC, but they don't know what it is all about. Okay, so DIC stands for disseminated intravascular coagulation. Disseminated intravascular coagulation. That is what DIC stands for. Yes. So DIC stands for disseminated intravascular coagulation. So I want you to understand that DIC is not a condition on its own. DIC does not occur on its own. The way hemophilia occurs, it occurs when the child inherits this gene from their parents. The child can now develop hemophilia. No, the way blood glucose, diabetes mellitus occurs, that is not the way DIC occurs. DIC is a complication of a disorder, of a condition. Okay, DIC arises from a lot of conditions. There are a lot of conditions that can lead to this disseminated intravascular coagulation. For example, preeclampsia. Okay, when a woman has preeclampsia, it can lead to the HELP syndrome. Okay, the HELP syndrome can now lead to DIC. Some blood disorders. Last year, I taught you about some blood transfusion disorders. Did I? Did we discuss the blood transfusion disorders? Did we discuss blood transfusion disorders, nurses? Or did the other instructor, I think the other instructor talked about blood transfusion disorders with you guys. I don't know why is this thing not working. Okay, Kwame said he's new here. Welcome, Kwame. How are you? Welcome, 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 welcome. I welcome all the new people here. It's so nice to see you guys. It's so nice to be your instructor. Oh my God, I should have introduced myself and also allowed the new people to introduce themselves.
Yeah, we have seen some effect of transfusion, as you said.
Yes, that's what I'm saying, that you guys
We
were
have
taught.
seen
Go ahead.
hemorrhages.
You have seen what?
Hemolysis.
Hemolysis. Yes, yes, there is hemolysis.
Hemolysis,
Mhm.
fever, and the
Does
allergy.
fever occur on its own? So we have the hemolytic blood transfusion. Do you guys remember? I know I'm the one that taught that class. I taught that blood transfusion reaction when I taught about the ratios factor. Was it not in this class? Was it not in this class that we discussed ratios factor? We talked about hemolytic blood transfusion, circulation. It was here. Well, so as I was saying, the hemolytic blood transfusion, the complication of hemolytic blood transfusion is this DIC. So that is why the hemolytic blood transfusion is the most dangerous of all the blood transfusions. Okay, the hemolytic blood transfusion is the most dangerous of all the blood transfusion because it leads to this disseminated intravascular coagulation. Okay, so let's dig into it now. This disseminated intravascular coagulation, a lot of time, is known as the consumption coagulopathy. I'm gonna write it down. You don't need to. Don't worry. You're gonna understand it. Consumption coagulopathy. You're gonna see why we call it the consumption coagulopathy. Okay. So now, the reason why we call it the consumption coagulopathy is that in DIC, what happens is that, remember, as individuals, we have the fibrinogen, right? The fibrinogen is a clotting factor, right? And fibrinogen helps our blood to clot. Now, in disseminated intravascular coagulation, what happens is that disseminated intravascular causes the formation of too many clots than our body needs. There are three things that happens in DIC. One is the formation of excessive clots. So as a result of the formation of the excessive clots, remember that it is the fibrinogen that enables us to form clots, that enables our blood to form clots. Now, DIC is going to cause the formation of so many clots, thousands of clots. Now, because of the formation of these so many clots, the DIC will use up the clotting factors. One, formation of a lot of clots, use up of clotting factors. Because this DIC, this condition has used up all of the clotting factors, there will be no clotting factor left in case of any form of bleeding. The client will now bleed freely. Do you get it? I'll repeat. One, DIC, they call it consumption coagulopathy. Consumption. It is using up. it causes the formation of several clots. As a result of the formation of these several clots, there will be a use up of the clotting factors. Those clotting factors that enables that whenever we have an injury, there will be a clot. It will cause the blood to clot, and then the blood will stop bleeding. All of that. Those clotting factors, DIC will use it up. It will use it up. When the individual now needs these clotting factors to enable the blood to clot, maybe during bleeding or anything, there will be no clotting factor left. So the client will bleed freely. So are you seeing it? There is formation of clots. 2, formation of clots, bleeding. Are you seeing it? So now, as a result of this formation of clots, remember that these clots, they are forming several clots. We don't remember that in an individual's body system, we don't want these clots to form a lot, because when there is a formation of these clots, it can lead to thrombosis. Now, in a client that has DIC, as a result of this formation of these clots, it can lead to thrombosis. And this thrombosis can travel into the client's extremity, causing DVT. DVT stands for deep vein thrombosis. Okay? And deep vein thrombosis is the formation of thrombosis in the client's extremity. It is unilateral. Unilateral is that it occurs only in one leg. So now, that thrombosis, that clotting factor that has already formed, it can either travel to the leg and cause DVT, or it can travel down into the client's brain and cause ischemic stroke. Are you seeing the lot of conditions that can happen? Now, that clot, that thrombosis that has already occurred in that client's leg, that has caused that DVT, it can dislodge. Yes, it can dislodge. And when it dislodges, it can travel into the client's lungs and cause pulmonary embolism. Ask me a question, please. Ask me a question, nurses. If you understand, give me a thumbs up. If you understand, give me a thumbs up. If you don't understand, ask me a question. Do we understand how DIC occurs now? Remember, there are 3 factors. We call it the consumption coagulopathy. I want you to get it. All right? I want so that even if you're sleeping and someone wakes you up and say, how does DIC form? You're able to explain it. You don't have to memorize it. You don't have to cram it. Okay? Now, first of all, there is a use up. First of all, there is formation of clots. It forms excessive clot all over the client's body. Now, it now uses up the clotting factors. Those clotting factors that are supposed to help the client to clot blood, especially during injury. Right? It uses up those clotting factors. Now, when it uses up those clotting factors, what will happen? The client can bleed. Now, I want you to understand these 2 things. Formation of clots, which is thrombosis. Secondly, bleeding. Are you seeing it? Now, the client who has this disseminated intravascular coagulation is at risk for thrombosis and also bleeding. Remember, the thrombosis can travel into the client's extremity, either the left leg or the right leg, and cause DVT, deep vein thrombosis. That clot, the thrombosis, can also travel into the client's brain and cause ischemic stroke. Okay? Do we understand? Do we understand?
Yes, it's understood.
Sorry?
I said yes, it's understood.
Beautiful. So now we see how this DVT occurs. Now let's go ahead. Beautiful. Please mute your mic if you're not speaking. Okay, so some assessment findings that we can see. Okay, you can ask your question, Kwame.
Please, when I joined, I heard you saying that with this condition, you don't have to give IM or even up a line. So I want to ask, in case you are giving any form of medication or any therapy, probably blood transfusion or any other therapy, how are you going to give it to these patients?
Remember that the one I said that no IV was for hemophilia. Hope you're not missing it all.
Okay, all right.
Yes, it was for hemophilia. For hemophilia, no IM, no IV. I just started discussing this DIC now. What I just explained was the pathophysiology.
Okay, all right. So in the case of hemophilia, if in case you want to probably give any medication, how are you going to give it?
That is what I'm saying now. We avoid it does not mean that when it is necessary, we don't give. Okay? When this client really needs a blood transfusion, when the client needs a blood transfusion, we are going to perform the IV cannulation, but it is performed under vigilance. Most time, it is the healthcare provider that is going to set up this line. Do you understand? But we avoid it. Remember that I mentioned that even if we are giving the IM injection, if it is very necessary that we should give the IM injection, after giving the injection, you're going to apply gentle pressure on that site. Do you understand? We apply gentle pressure on that site. But for the anklets, always choose avoid this. Okay? But it doesn't mean that in real life, if it is necessary for us to perform a blood transfusion or even to give the client an injection, that we don't. We do, but it is under vigilance. Okay? Does it make sense? Kwame, are you good?
I'm good, please.
Please turn off your camera. All right. So now let's talk about some of the signs and symptoms of this. I know that it's already 9 o'clock. Should we stop here and continue tomorrow? I know some of us have to work and all of that. Should we stop here? It depends on you guys. Okay, let's stop here.
Because of the network issue, we didn't start at 7 exactly.
Yes, I know, but I know that some people want to work and all of that. So it depends on
Okay.
the majority.
Okay. That's fine.
It's already 9:04. Should we stop or let's just finish the IC? So,
Then let's
so
finish with the DIC.
okay, all right. So for the signs and symptoms that we are going to see in this is that the client has severe bleeding. I've already told you how the bleeding occurs. Okay, so the client will have severe bleeding, and remember that I mentioned the signs of severe bleeding, peteke. Okay, so the client will have peteke, purpura. Let me write it down. Purpura, peteke. Okay, so these are purple spots. The client is going to have purple spots on the skin. So these purple spots on the skin, they indicate bleeding. Okay, so the client will be bleeding. The clients can have epistaxis. Epistaxis is bleeding from the nose. Remember that the clients can have severe bleeding. So the clients can start bleeding internally and blood will start coming out from the client's nose. That is epistaxis. Okay, then the clients can also have bloody urine. Okay, pass blood from the urine, which is hematuria. Okay, then blood in stool. The clients can also have blood in stool, which is melena. Okay, I've already told you how these thrombosis can form and lead to stroke. Okay, how it can also it can even lead to myocardial infarction. All right, so remember that a myocardial infarction is when there is a blockage of blood flow to the myocardial muscles. Now, when there is a formation of these blood clots, these thrombosis can go ahead and block the coronary arteries. Okay, so when there is a blockage of these coronary arteries, there will be a deficiency of blood flow to the myocardial muscles, which is going to lead to myocardial infarction. All right, it can lead to stroke, it can lead to myocardial infarction, it can lead to pulmonary embolism. So remember that I told you that those clots can travel to the lungs and form pulmonary embolism. The clots can travel to the legs and cause deep vein thrombosis. These are some of the things that can happen. Remember, formation of blood clots and also severe bleeding. Okay? Then let's move on. Remember that I also told you that DIC does not occur on its own. It's a complication of a condition. For example, preeclampsia. Okay, hemolytic blood transfusion. It's also a complication of sepsis, infection. It's also a complication of placenta abruption. Okay, then let's go to the treatment. Now, our priority is to treat what caused that DIC, the underlying factor. If it is the sepsis that led to the DIC, we are going to treat the sepsis. If it is the placenta abruption that led to the DIC, we treat the placenta abruption. So we are going to treat the underlying cause. What is that thing that is causing that DIC? Remember that it's a complication of a condition. We are going to first of all treat that condition. Then after that, we give blood transfusion. Okay, we give packed red blood cells. We can give packed red blood cells to replace the blood loss. We give fresh frozen plasma, in fact, whole blood. We are going to give whole blood. Okay, then the next thing we can do is we give health education to the client. We give bleeding precautions. I already told you about the bleeding precautions. They should use electric razors, they should avoid contact sports, they should avoid IM injections, IV injection, um subcute. Then also there are a lot of people that love to floss. Okay, so we encourage them fluoxing no floxing, because they can injure their gums and start bleeding from the gums. Okay, then they should use only soft bristle toothbrush so that they don't injure their gums. Any question? I think I've explained this TIC in the layman's language. Any
Please,
questions?
yes, please, the petachi and the pepper, are they the same?
Ow. Is the petaki and the purpura, are they the same?
Yes.
I want to ask you now.
I'm asking.
Yes, me, I'm asking you too. Who knows? Does anybody know?
I know of the petachi to be the pepper spots on the skin. So that's why I want
Okay.
to know whether the pepper is the same as the pepper spot.
Yes. I know. I want to know. I know that I understand that you're asking. It's fine, Suleiman. So I just want to ask if any other person knows.
Okay.
Oh, okay. I know some of them here have been reading, they've been doing their Q bank, so some people might know. So when we say when we talk about petechiae, and then when we talk about purpura, in fact, whenever you see these two, petechiae and purpura, on the NCLEX, just know that that client is bleeding. Okay, just know that the client is bleeding. Okay, the client is bleeding. Then purpura is when the client has purple colored spots on the skin. They say non-blanching. Non-blanching. So remember that as individuals, once you see something on the skin and then you do it like this, you press it like this, you see that it will just spread, like it just spread. Like you see the skin, like it will just clear. If it is not that purpura, okay? But purpura, once you press it, it will still be where it is. Okay, so the purpura is purple colored spots on the skin, and then this purpura can also be in the mucous membrane. Okay, it can also be seen in the mucous membrane. Then the difference between petechiae and purpura is that petechiae is tinier. How do I measure it? It is very tiny. It's like a pin. You know, when the mouth of a pin, they call it pinpoint, tiny pinpoint, just very tiny spots. But purpura is like, you know, when somebody has like a bite mark, it's bigger than petechiae. All right, purpura is larger than petechiae. That's what I want you to understand. Okay, so and then petechiae also occurs in, you know, when someone has rashes, you know, those rashes, they occur in clusters. That's the same way petechiae occurs. You see spots, tum, 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 tum. They occur in clusters. But purpura is that you can see this tiny mark here, then you see a space before you see another one. I don't know, does it make sense?
Okay.
Does it make sense to you? Let me show you a picture. I want to show you a picture. So I'm going to be sending this picture to the group chat. So you're going to use it to differentiate. Okay? I'll send it to the group chat. Then you use it to differentiate. Both have the same color. So I just want it.
Okay.
So I just sent it to the group chat. Have you seen it? Have you seen it? Suleiman, have you seen it?
Yes, I've seen it.
All right. So we are going to be stopping here for today. So I'm going to see you guys tomorrow.
Okay. Thank you very much for your time.
All right. Did we enjoy the lecture? Okay, bye-bye,
Thank you.
everyone. See you guys
Okay. Bye.
tomorrow. Okay?
Okay.
Bye-bye.
Bye.